After listening to this module, you'll be able to identify typical settings in which health education is done.
Settings of health education. So now that we know what health education is, we know the purpose and meaning of health education and understand its evolution, let's talk about where health education is done. Health education is done in a lot more places than just the school setting. Health education is done in a ton of different settings, but there are generally 6 main types of settings. Hospitals. Hospitals are clinical settings. Patient education about cardiovascular disease or high blood pressure is typically done by nurses who unfortunately have little health education training. Their educational background is much more clinical than psychological. They receive very little training, if any at all, on how to educate people and make permanent behavioral changes. They're good at putting together a brochure of information, but health education is so much more than just disseminating information in a brochure. So overall, the quality of health education in the clinical settings is very much lacking. Fitness gyms. Staff at fitness gyms such as 24-Hour Fitness or LA Fitness typically attempt to do some health education. Trainers teach clients about the appropriate ways to exercise and the types of exercise. However, again, unfortunately, health education is done many times by completely unqualified personal trainers. They might have knowledge about exercise, but health education involves not only educating people, but getting them to make permanent behavior change. Many personal trainers receive very little, if any, education about behavior modification techniques. They might be great motivators and cheerleaders for their clients, but permanent behavior modification is extremely complex and therefore usually requires someone who has a background in psychological and behavioral aspects, which is what a health educator has in order to help facilitate successful and permanent behavior change. Also, trainers typically focus on one subcategory or one aspect of health, and that is exercise. They typically don't focus on other areas such as nutrition, although they might touch on it, and stress management. So the quality and quantity of health education is lacking tremendously in this setting as well. Schools. Health education is typically done in public schools. Unfortunately, the government at both the federal and state levels don't place a very high priority on health education in comparison to other subjects such as math, reading and language arts, and science. So not very many health classes are required by the state. Some states are better than others. But unfortunately, California is not one of the better states. So teachers who have very little educational background and training in health are having to teach health. Again, physical educators or coaches or sometimes biology teachers are asked to teach health in the schools. I hope I'm not starting to sound too negative, but overall, both the quality and quantity of health education in the schools is also lacking tremendously. Many of you are not health education majors, but will be teaching health in your classes. So don't get me wrong, sure, it would be great if there were enough money to have health educators teach health. But since this is not the case, and has not been the case for quite some time, I'm a huge advocate of teaching non-health professionals, such as yourselves, how to teach health. Colleges and universities. Most colleges and universities have health educators on campus. We have health educators here at Cal Poly Pomona who are employed by the Student Health Services and who typically work at the Student Wellness Center. Fortunately, these health educators who plan, implement, and evaluate health education programs for college students usually have an educational background in health education and probably are more prepared to do health education than the other settings, although there are instances where the quote-unquote health educator on campus has an educational background in nutrition or biology rather than health education. But overall, the quality of health education done at colleges and universities is typically okay and better than the preceding settings that I just discussed. Corporate or worksite setting. Fortunately, more and more companies are recognizing the importance of health education in the worksite and hire wellness professionals or health educators. Studies have shown that businesses with health education and health promotion programs have healthier and happier employees, which translates into decreased absenteeism and increased productivity. Health educators in this setting typically have a health education or health promotion background, but like the health educators at the college or university setting, those in a corporate setting sometimes have a related background like exercise science and little in the way of health education. But overall, the quality of health education done in the corporate setting is typically okay as well. Community agencies. Health education is done at government health departments like the LA County or San Bernardino County Health Department, or non-government agencies like the American Red Cross or the American Lung Association. Although some government health departments just have their nurses do health education, many hire health educators with a background in public health, which is slightly different than health education. But the training and educational preparation in health education for someone with a background in public health is actually pretty good. But because of budget cuts and lack of priority, many health departments don't have enough health educators to adequately provide health education for their communities. Non-government agencies typically don't hire people with a background in health education to do their health education. So health education done in government agencies is okay, but unfortunately not so good in non-government agencies. Qualified health educators are lacking in each and every one of these settings, in some settings more so than others, as I mentioned. So if there's a lack of professionally trained health educators in these settings, then the quality of health education is lacking.
Key points. Health education is typically done in multiple types of settings. However, unfortunately, many people who teach health are not qualified, so there is a need to improve the training of those who are in positions to teach health. And that's it.